We all set? Good afternoon and welcome to our COVID-19 outbreak update for today, Wednesday, May 20th. It is just me. Wednesdays are Dr. Burstein's day off. And I thank you for joining me as we do something a little different. We hold it outside. We have a beautiful day and hoping that the media will socially distant. I know we're wearing masks. That's a good thing. We're joined by Kate from Deaf Access Services. We'll be providing American Sign Language to those who are watching at home. We have some information to provide, and hopefully we'll get through this. It's a little different than usual. If you're looking for the slides that I'll be talking about, they will be on our Twitter page as I speak. So as soon as I speak, you'll be seeing them on our Twitter and Facebook pages as well. So you can follow along on social media with the information that I'm providing as well. We're just doing this for today, a little different, but appreciate everyone coming out. The usual provisos, the information that's being provided is as accurate as approximately an hour or so ago, so it is a subject to change and usually does. With regards to case data, as of this morning, May 20th, there were 5,054 total positive cases since we started, out of 32,873 people tested. Interestingly, the most recent tests that have been coming in have been averaging less than 10% with regards to positive rate for every individual that's tested. So out of 100 people that might be tested in the most recent tests, less than 10% are coming up positive. The overall positive rate is still around 15% in total, but that's primarily because we did a lot of testing of first responders, healthcare workers, others who were ill to begin with, and now a lot of other people are getting tested who are showing no signs. Unfortunately, 455 people have died since this started, 6 more since yesterday. These are all lab-confirmed cases. These are no presumed positives, and I do offer my deepest condolences and sympathies to the loved ones who've lost someone as a result of the COVID-19 outbreak. Regarding hospitalizations, we revealed a little earlier, there were 182 individuals that were hospitalized in Erie County hospitals for COVID-19 on May 18th. 45 of them were in the ICU and 33 had an airway assist. To give you some idea of where we've come in a fairly short period of time, on May 1st there were 241 individuals that were hospitalized in Erie County hospitals for COVID-19, and as I said, on May 18th we're down to 182. There were 98 individuals in ICU beds on May 1st, and we are now down to 45, and there were 73 individuals who were intubated on May 1st, and that is now down to 33. So there's been a significant reduction in all categories. With regards to hospitalization data, you know the chart that looks like this. They're actually in the last 2 days, there have been 35 new hospital admittance, and there have been 17 discharges, so roughly double the amount of new admissions compared to discharges. So we were looking further to figure out what's happening with regards to that data. And what we're seeing with regards to hospitalization data, like this, the chart that you've seen before, is that the individuals 64 and younger are actually going down in the last few days and are at the lowest percentage of hospitalized patients since at least April 1st. We do not have the data from March. But to give you an example, on May 13th, 46% of all individuals in Erie County hospitals were 64 and younger. That was 92 individuals. 54% were 65 and older, or 109 individuals. On May 18th, there were 182 hospitalizations. 36% were 64 and younger. That was only 66 people. And 64% were 65 and older, 116 people. So what this shows is our numbers with regards to the younger population are dropping significantly in hospitals, but we are seeing growth for those that are older. And so we are reminding everybody that we need to continue to follow the smart social distancing rules, to wear our masks when we're out in public. We're wearing them to protect ourselves and to protect other people, including those in our senior population. So it is a little concerning to see that the numbers are still going up, or staying fairly average for our senior population, but we are seeing a significant drop for those 65 and younger in hospitals, and that's a good sign, and it shows that people are following the smart social distancing guidelines. Now, what happens if they stop following smart social distancing guidelines? Well, we do know there's still people that are contracting the coronavirus in our region, and anyone can get it regardless of age. So if you think I am 24, it doesn't matter if I get it. There are people who've been in their 20s who've got it and have been hospitalized. So the best thing to do is to follow the smart social distancing guidelines as possible. Hospitalization data, we've had a little uptick in the last couple of days for all of Western New York, as well as Erie County, and as I noted, it's primarily because of the increase in the population for those 65 and older, as the population of the other groups from 64 and younger have actually dropped. Cases by age and gender, so that chart that you often see, very similar to what we've seen before, that males make up a minority of the population in Erie County. Females generally make up about 51.5% of the population, males 48.5%. But depending on the age group, sometimes it's females that have a greater proportion, sometimes it's males. And of course, the highest group of those who we've tested with confirmed COVID-19 cases right now is 80 and above, with over 800 cases. And all these slides, once again, can be found online. Mortality data with regards to gender and age. And as it stands right now, females still make up a majority of the deaths in Erie County, though males make up the majority in every age bracket, except for 80 and above, in which there are 151 females and 101 males. And males make up the majority in every other age bracket, except 20 to 29, in which there was one individual, a female, from 20 to 29 who passed away, and there were no males. So once again, we believe that one of the reasons why there are much more females that are dying above 80 and above than males is just because there are more females in the 80 to above age bracket than males. And they live longer generally, which means they're more susceptible as they get into their 90s and further ages. Mortality data with regards to ethnicity and race. Whites are now making up 80% of the overall population of those who've died, and African Americans have decreased to 17.4%. That's the lowest percentage for African Americans since we've really kept track of this data. African Americans make a little less than 15% of the overall population. So there's a slight discrepancy between African Americans who've passed as a result of the COVID-19 versus the average population, but it is not huge. It's not like it was at one point in which it was 33% or so of the overall deaths were made up by people of color, African Americans, when they make up a much smaller proportion of the population. And Latinos are still trending lower than their population. 1.5% of all fatalities is compared to 5.7% of the normal breakdown that you would see of Latinos and Hispanics in Erie County. COVID-19 testing through the Erie County Department of Health. As you may know, our phone lines got blasted yesterday because people were calling for antibody testing. All of our antibody testing is actually full for the whole month of the remainder of the month of May. So any antibody test, if you call to schedule for an antibody test, you will not be able to get an antibody test until June. We've had so many people call, thousands who've tried to get antibody testing in just the last 24-hour period. 858-2929 is, of course, the phone number to call for any testing, whether it's the PCR testing, the diagnostic test, or the antibody test. These are all by appointment only. You do not need a doctor's referral, so you don't have to worry about a doctor's referral. If you don't have a doctor, that's okay. You can still get tested for the diagnostic PCR test or the antibody test. And if you need it, foreign language interpretation is available. So if you want to get tested, it's available, 858-2929. However, if you're looking for the antibody test, the earliest those tests are now available is June, as thousands have signed up in the last 24 hours. Reopening, we know we are in phase one. We've met all the metrics for phase one. I'm very happy about that. The first day, of course, was yesterday, in which we were able to enter phase one, but that's not everyone. That's only certain industries. Industries will be reopening by phase. We'll go a little bit into not only the phase 1 but phase 2 and what they should be doing right now. But if you're a business owner and you're questioning what phase your business falls, there is a new link that is available through New York State in which you can check to see where your business would fall. It's the Business Reopening Lookup Tool at www.businessexpress, all one word, www.businessexpress.ny.gov, Gov/app/NY forward. So if you're a business owner and you're not certain what business you are in, you can check online. Phase 1, of course, phase 1 is we're open for phase 1. Phase 1 is construction, agricultural forestry, retail limited to curbside or in-store pickup, manufacturing and wholesale trade. If you are in those and you have not put together a reopening plan, you cannot open. You have to have a reopening plan, and it's got to be available for your staff as well as patrons to review. Phase 2, we're not in phase 2 yet. But if you are one of the businesses that falls in phase 2, you should be working on your reopening plan right now. And that includes professional services, full retail, administrative support, real estate / rental and leasing, as well as barber and salons, which I need a lot of. Though I think I'm going to keep it a little longer than I had it before. So if you're in phase 2, before you can reopen, you need to have a reopening plan in place, and you need to affirm through the New York State website that you have a plan. If you don't do either and you open, you're going to be subject to closure. And as has been informed to me by the state, you also risk, if you have insurance. We have some motorcyclists going by. We have been informed in New York State that if you reopen and you do not do it properly, if you reopen and you're not authorized to do it, there's a good chance your insurance may not cover you because you were illegally opened. So we think it's very important for the business owners to understand, if they say, to heck with it, I'm just going to reopen. Well, not only are you violating the current laws, the emergency orders, and will be shut down, but we've had conversations on our 4 o'clock calls with the New York leadership that there's a very good chance that if you have insurance and somebody has an issue and you try to use your insurance because you've been violating an emergency order and you're not authorized to open, your insurance probably is not going to cover you in that situation. So do not open until you have authorization to do so. With that, I want to thank everyone. We keep on doing good work. Our antibody testing is basically coming in at 7.5% now for every one we do. We've been doing that for 4 weeks. The first week was a little high. The last few weeks have all been coming in at about 7.5%. And as a result, it just leads us to believe, considering we have nearly 30,000 people that we've tested for antibodies, a very good sample of Erie County residents, that it's basically saying that 92% of the population has not contracted the coronavirus. So you still need to follow smart social distancing guidelines, and don't be cavalier about it. We do not want to go backwards. I don't want to hear that our hospitalizations have spiked so much that we then got to shut down again. That's the last thing any of us want to do. With that, I'll open it up to questions.
The governor this morning was talking about how starting Thursday, religious ceremonies can have 10 people or less, and then on Memorial Day they can have ceremonies or less, like the counties can say no. So what has been your guidance on church services and then Memorial Day ceremonies?
Well, I think it's going to be pretty tough to have church services with 10 or less. I think they're also talking about some other church activities like funerals, weddings, where they could have 10 or less and they could shuttle them throughout. It's very difficult to have any type of church or synagogue or mosque service where you only have 10 people at a time. I know the leaders of our houses of worship were looking forward to a guidance associated with houses of worship. I mean, they've pretty much been stating that the full reopening was not going to happen until phase 4. So I believe this is to allow some that have christenings, weddings, or funerals to actually legally be in the facility, and if they have to, they can shuttle people through, but have no more than 10 at a time. We are, as we've said, now that we've gone into phase 1, it's not totally surprising that we would say it's okay to have gatherings of 10 or less, but not more than that. And I believe as time goes by, you're going to see that number increase as we go into new phases.
The governor previously announced that state-owned beaches will be opening up for Memorial Day
The county beaches will be closed. They normally would not open until June anyway. However, we have found out through our Department of Environmental Health, which is required to do beach testing, it appears the only beach that will be open will be Woodlawn Beach. Every other beach that we've contacted in Erie County will not be open. That includes the town beaches that exist. The state beach in Grand Island at Beaver Island Park will be closed. All the town beaches, the county beaches. So our parks will be open, but we are not yet in a position to open the beach. We certainly don't have lifeguards for swimming, and it may be warm out, but I don't know if anybody would want to go swimming in Lake Erie because it's still pretty cold. It's not polar bear, but it's pretty cold. So the only beach that we're aware of that will actually be open will be Woodlawn Beach. Michael? Yes, we've advised. Our Parks Department will be advising. Local law enforcement has been advised when it comes to Bennett Beach and Went Beach. We work with the town of Evans. The main parking lot at Bennett Beach will be closed, as it is normally, unless they're swimming. There's a small little parking lot for those that would use the park otherwise, but the main beach will be closed. The main parking lot will be closed. And I do know if you park on the road there, there's no parking there, you will get ticketed by the town of Evans police. That's just standard. It's always been like that.
How optimistic are you? June 2nd is the first day that we could potentially reach phase 2. Are you optimistic that we'll actually be able to start phase 2 on that day?
I hope so, but we're going to watch the data. Considering Finger Lakes and the central region, which is Syracuse, so Rochester and Syracuse opened a few days before us, we're going to watch and see what happens to them, because they would go first. Now, they've also had a big spike in hospitalizations, and that's really concerning. I do know that the central region actually has had more than double in hospitalizations, the highest they've ever had. The Finger Lakes, Rochester has had the highest it's ever had. So it's very concerning, and we're watching out for that, because we do not want to do the same thing, have this reopening, and then watch our hospitalizations go up and the deaths go up in the hospitals, and then theoretically not only not move to phase 2, but potentially have to go backwards to phase 0, so to speak. Sandy? It's semi-squishy. The question was how squishy are the metrics moving up, and it's semi-squishy. We do know we have to keep the hospitalizations down and the deaths in the hospitals down. There was a lot of questions by some in the public about issues associated with, well, your death number really didn't decrease that much. It did decrease in total, but you're saying that you were able to open under the metric. The metric is deaths in hospitals. So if somebody does die in a nursing home, it doesn't qualify against that metric, though they may have been a COVID-19 patient. So as long as the hospitalization numbers don't go through the roof and the death numbers don't go through the roof, and we're still able to keep the ICU beds and the regular beds open, and they can do elective surgeries, I think we'll be okay. If we see those numbers start going way up, I know from the conversations I've had with the state is they're going to do one of two things. They're going to keep us at phase 1, say let's try to keep that number down, or they're going to say it's so bad you're going back to phase 0, so to speak. And I think that's what they're facing right now in Central and the Finger Lakes. Is they're actually going they're a little worried about that. I know County Executive McMahon and Onondaga County and County Executive Bello and Monroe County are both a little concerned about that number, because they got to reopen a little earlier than us, but they're also risking potentially getting stuck in phase 1 or worse, going backwards, if they can't get their numbers down. Steve?
I know you spoke about this earlier about the budget and having to make tough decisions about whether or not they have to cut. Are you any closer to those decisions as to whether or not you'll have to and how deep you'll have to go?
Yes, we are closer. The question was on the budget. Are we closer to making budget cut decisions? And the answer is yes. We should be sending over our proposed package to address the deficit no later than the first week of June. So we're basically a week and a half out. I wish they had come up with greater resolution right now in Washington with regards to a new federal aid package. Negotiations are ongoing, but I've been told it's probably not going to get done before Memorial Day now, which is what we were hoping for. So we're going to propose a package. We're going to look at all options, and it's significant. If there was one good thing that's come, or two good things that have come out of the last week, is we got our first sales tax data for the end of March, April, and it was better than we thought. It was only a 24 to 25% drop, not a 50% drop, which we were expecting. So our sales tax data came in better, but 25% drop is bad. As I think I said recently on an interview, the difference is we were projecting horrible, and it came up really bad. So it's not as bad. It actually, we originally were looking at a $220 million deficit. We think the deficit's somewhere around $170 million now based on the projections. And then we also got clearance from the federal government to use CARES Act funding to offset costs for the workforce that has been responding to the COVID-19 outbreak that were already in the budget. We were told if they were already in the budget, I should say, we were told initially if they were already in the budget, then we could not use CARES Act to pay for it. And then they've issued new guidance that says, yes, you can, as long as they're responding to COVID-19 outbreak. So for the individuals who've been spending their time on it, whether it's 100% or 80%, that portion of it will be paid for out of the CARES Act funding we had, which does offer some help to us.
Give us an idea. Can you talk about layoffs?
The question was, can I give you an idea if we're talking about layoffs? As I've said before, everything is on the table. And that includes layoffs, that includes use of fund balance, that includes continuing to cut assistance to third parties that we offer funds to. Right now, it's not looking like we're going to do anything for Operation Primetime, the summer youth program, because we really, at this point, don't know if there can even be summer youth programming. As of right now, there can't be. It hasn't been approved yet. So it's possible we may cut that. And so we're looking at all these different programs that exist that we have the ability to cut. I don't want to, but I may have no choice because I have to end up with a balanced budget. In local government, we don't print money. The federal government does. So we have to have a balanced budget. Is anybody else who has not asked a question yet that has one? If not, I'll go to Marley and I'll go back to you, Madison.
Obviously, looking at the Finger Lakes data, what's going on in Central New York, we now have holiday weekend coming up. There was Mother's Day just a couple weeks ago. Are you concerned that people will be lax, especially now with hearing the phrase reopening, and we could see hospitalization start to spike once again?
The question is whether I'm concerned about, with nice weather for Memorial Day, that the hospitalizations are going to go up. We saw a little bit of that after Easter. We have not necessarily seen a true Mother's Day spike. We saw a couple days where it went up, but nothing that was terrible. I am very concerned. Yes, you can gather in smaller groups again, but as it was noted with regards to church services, temple services, and like, it's less than 10. We're not talking about getting the big party, the block party, back together. And even when you get together, if it's 10 or less, you have to follow smart social distancing guidelines. You got to be spread out. You got to wear your masks. A lot of people think, why do I do that? Well, it's to protect yourself and to protect others. As the governor noted earlier today in his press conference, the percentage of individuals who tested positive in each of the 5 boroughs, in New York was higher among the general populace than it was frontline workers. Why? Because frontline workers are wearing masks. They're using smart social distancing guidelines. They're using PPEs. So if you're not using masks, there's a much higher chance you're going to catch COVID-19. And as we said, there's a lot of asymptomatic transmission going out there, which means individuals who are positive but don't know it because they're not showing any signs, they can spread the virus. So it's very important that people understand that if you go and you have a picnic, you see people you haven't seen in a while, they could have it and they don't know it. You could have it and you don't know it, and you could spread it to them. I mean, I had my antibody test a week or so ago and it came back negative. I haven't any reason to believe I'm positive at this moment. I have had no symptoms or anything like that, but it's possible. So that's why when I go back and leave here, I'll put my mask on, walk through the hallways, and won't take it off until I get into my office. Madison.
So the governor talked about reopening. He said we are going to see an uptick in those numbers. He said it just has to be controlled. And then when I talked to the Lieutenant Governor last weekend, she said for those businesses in our area that have gotten conditional approvals to reopen, there haven't really been any outbreaks or any upticks
The question was in regards to the businesses. Are they working to get their people tested? Are they having any difficulties? And when we had the essential workforce, we were not seeing outbreaks in essential workforce. I would caution to say we do know of some outbreaks. Smaller locations, manufacturing. There was one on the west side that we believe was one of the driving reasons why there was continued spread in the Burmese community. Some of the larger employers that were open, we are not aware of any. So we're just keeping the monitor. So that's why our contact tracers. Okay, where do you work? And if they see, wow, we had, and I'll use GM because they were closed until recently. But if let's say they were open, and if we had a month ago and we had 10 GM employees come in the same week, we go, we got a problem with GM. Now we don't have a problem with GM. I'm just using them as an example because they were closed. But if we got that, then we take a look and then we go, okay, we got an issue. We have to talk to the employer and find out what are they doing. We would send our Department of Health sanitarians out there to confirm, do they have a reopening plan for safely reopening? If they don't, you're shut down. Simple as that. If you're allowed to open and you don't have a reopening plan, guarantee you, we're going to shut you down. So what we're hearing is the employers are taking it very seriously. They are providing PPE to their employees, and they are doing what's necessary to ensure their safety. So if we hear stories otherwise, then we will shut them down if we have to, or provide them additional assistance so they know what they need to do going forward. Michael.
Marley's question from a moment ago. To what extent is Erie County law enforcement going to actually be enforcing Memorial Day get-togethers? I think I'd be patrolling the suburbs and saying, hey, there's 10 people there, you're not wearing masks, shut them down.
Well, we have had to, in the past, send law enforcement out to advise individuals they're not following the rules. Most of the time, the people broke up. So we will continue to do that. We've had conversations with the sheriff's office. We know the state police have been advised that by the governor's office. On the call I had with local representatives earlier this week, supervisors and mayors, I did inform them that we are responsible for enforcement, for compliance. The governor said it, which means law enforcement is too. So you have to let your local police department know they are responsible. And if they're going to say, no, we're not going to do that, they're actually violating the law. And I hope that never happens. Sandra first. There's only hospital deaths. It's always been that. No, that has always been only hospital deaths. And as long as we've been keeping it, it's much lower, or not much, but generally lower than the number of deaths that day. For example, on May 17th, we had no deaths in area hospitals. But we did have some deaths in Erie County. And those were generally associated with nursing homes. Or they could have gone home. They could have had COVID-19, not been testing positive anymore, released home, and still died from the illness that may have resulted, like pneumonia, or we've heard even of kidney failure, things like that. Michael? I have no indication. I do know of one death in an adult assisted living facility in the last week, but beyond that, it's almost all nursing home cases, and those numbers are available for review on the New York State site, and they have grown. But I have not been provided any information about deaths at congregate care facilities, including like those that are available for the like developmentally disabled. We have over time had a case or two in some of those congregate care settings, but no deaths that I'm aware of.
One more thing. When you look at, I guess, the first day of reopening the other day, do you know how many businesses were cited for not either wearing masks or not having that safety plan at the
I don't know. Yesterday was actually the first day of reopening, so I have not had that data yet. I do know there were some calls that came in with regards to lack of safety plans, and our health department went out, and I believe that was all resolved. So, but yeah, we expect more of those calls and more of those issues. I hope that the business owners take it seriously. They've been waiting to get back to work for a long time, really, a long time. And it doesn't take a whole lot to come up with a business safety plan. And we've always said if they have questions, they could call Empire State Development. They can call our office here. And I know Empire State Development has received a lot of calls with regards to, okay, is this okay for me to do? What should I be doing? Depending on the production or what they do I need to provide full gowns or is a mask sufficient? So a lot of businesses have been taking it seriously and contacting me. Update on the business task force. Actually, the business task force, I believe, is meeting this afternoon. They're working on a number of different things continually. And a lot of the information that we receive from the partnerships survey is being utilized now. Basically, we found that most of the manufacturers in our region were open, at least a limited capacity, but they were open. Very few of them shut down. Construction was raring to go. We know that they're ready and they're open. And some of the other questions were more directed to us as a result of a particular associated with the business. But we continue to work with them. The ECIDA has more data. I don't have the latest with regards to the number of individuals who've applied for the specialized loans we have through the ECIDA. I don't have the latest data, but that is available through the ECIDA. Last question. The question was regarding ways to cut the budget and to cut road and bridge projects. Most of the road and bridge projects are paid out of capital funds. They're mostly paid out of capital, not all of it. We'll say this, if it's a capital project that's borrowed for, we will move ahead with that project. If it's a pay-as-you-go, we are looking at doing a partial cut on the pay-as-you-go line with regards to projects. I have already had those conversations. I've already gone through. We've done line items on projects, and we do expect that there would have to be some cuts because we just don't have the full revenue to pay things out of our operating budget. If it's a capital budget and it's borrowed, then we will move ahead with that because it's not the same. It doesn't have the direct impact like the money coming out of our operating budget does. With that, I want to thank everybody for coming out on this beautiful day, this gorgeous day. We will have a briefing on Friday. I believe it'll be indoors. We are not planning on having a briefing on Monday, which is Memorial Day. So unless there was an emergency, we'll have one on Friday, and then the next one would be the following week. So everyone take care. Bye. No, have not made a haircut appointment. Certainly, because I don't know when they can open. I can't open up, can't do a haircut appointment until we know that they're open.
So which saber do you think your hair now looks most like?
Which saber does my hair most?